Thank you, everybody, and thank you very much for inviting us to speak. This is from the three of us from the School of Nursing. And I think, just some reflections before I start quickly is that, I think everybody is experiencing this. It's been overwhelming, the exponential growth in AI. And I think that one of the things is that if we listen to the presentations, is most of the engagement has been around ChatGPT. And although the enthusiasts, which I count myself as one as well, have obviously expanded it to a whole range of other technologies as well. But I'm taking a slightly different stance here, because for us in nursing, this explosion of artificial intelligence has not only happened in education, it has very, very much happened in the health sector as well. So we have to really think about much more than ChatGPT, and really think about the reality that is facing us as to how do we manage the space between the technology, AI, and our client, which is the patient, and in education is the student. So for us, thinking about it, this managing the space between technology and the client is how do we carefully and responsibly integrate this new technology in our healthcare and education practices while maintaining a patient-centered approach, or in education, a student learning approach. And there's been wonderful, exciting examples already of people have been critically engaging with all of this. One of the things, but we haven't actually broadly touched upon, is that artificial intelligence, I think I read somewhere that it's the new electricity, and that it's going to be, bring about some of the changes like electricity did for us, which is probably a sensitive topic in our country. But so the thing is that we haven't really looked and unpacked at what artificial intelligence really entails, because we focus a lot on ChatGPT. And there are lots of definitions for it, and people have referred to some of their definitions, and it includes machine learning, deep learning, natural language processing, language translation, robotics, expert systems. But I think it's also important for us to differentiate between predictive AI, which is used to make predictions or classifications based on label data, which is supervised learning of data sets, and generative AI, which is ChatGPT, which generates new data samples based on patterns it had learned from unlabeled data. And it's that has raised a lot of the concerns and issues that people have discussed so far. In education, the issues for nursing education generally is very similar to all the issues that have been raised. And I'm not going to go into all of this in a lot of detail. I read something the other day which was very exciting, interesting, and said that ChatGPT has been used far more frequently by educators than students, although I think this might change as well. So I'm not going to comment much on this. There's been lots of detailed discussion about the natural language models such as ChatGPT, Bard, and Bing, and Cloud AI, which you have to use a VPN to get to at the moment, which helps us to explain educators complex issues. There are Microsoft Copilot is coming. It's going to be costed, I believe, and it will assist educators to improve the quality of educational content. There's also adaptive e-learning systems, which can help us to diagnose gaps in knowledge, providing personalized feedback, facilitating student collaboration. And there's also intelligent tutoring systems, such as teacher bots. So there are lots of artificial intelligence currently emerging in education, and we are grappling with ChatGPT is the first one. There's also been areas where people have talked about artificial intelligence in education administration efficiency, where administrative tasks performed by AI, and people have referred to this as well, to include marking, grading, developing personalized learning plans. There is data mining that can be done to evaluate teaching, and AI has also been employed in virtual environments. And this is specifically important for us in nursing as well. But there's been broader analysis around analyzing data for prediction. For example, in identifying students that might be at risk, or scheduling or dropout retention monitoring, etc. So as I indicated, for us in nursing, there are very specific issues around artificially enabled virtual reality or artificial reality in nursing simulation in our education. And you're all aware of the fact that we do have a digital innovation hub that has been established as part of our university, which is a very exciting, innovative project. And so there are opportunities around teaching foundational subjects, biology, anatomy, physiology, and physics, and these issues around clinical simulation and the use of artificial intelligence in that. There are currently people who are developing virtual reality scenarios around interprofessional readiness to practice, for example, augmented reality scenarios around wound dressings and haptic devices for injections, etc. And we are developing a little emergency trial as part of that. But specifically exciting has been the AI-enabled VR in clinical simulation. And so this is just what you see here is just an example of a clinical simulation program. It has clickable body systems, it has medical equipment, it has a virtual environment, and it has an AI doctor. And you can interact with this AI doctor using headphones and chatbots. And they developed this chatbot which operates through this sort of machine learning to predict interaction. So the student can study the scenario, the doctor does arrive and communicate about the issues. And the student is then guided by a robot companion. So these are very exciting innovations. Similarly, in our skills laboratories, we have high fidelity mannequins for learning. And one of the new developments has been the AI-enabled high fidelity mannequins. And so these mannequins have been programmed to respond realistically and have interactive experiences for learners. So they can incorporate speech recognition algorithms to recognize verbal demands. There's computer vision to assess students' physical assessment techniques. And they have got AI algorithms to simulate different conditions and physiological responses in time. And I've just provided some links for that. And all of this has been driven also, I think, for us around artificial intelligence in nursing practice, because one of the key issues for us as people in nursing education is we have to prepare our workforce for what is out there. And so artificial intelligence in nursing practice have provided access to evidence-based source materials via chatbots. There's also robots, emotional assistance robots, smart homes that monitors things such as falls. And people are saying that beyond saving us time, the intelligence in artificial intelligence, if used well, could make us better at our jobs. And so there has been generative AI applications in health, such as transcribing patient records. Google Med Palm is already used in Mayo Clinic and scored 67% in the sort of board exam. And for the AI used for diagnostics, one of the things have been patients can actually identify whether it comes from a clinician or an artificial intelligence bot, but there's a higher level of trust for preventive advice rather than diagnostic advice. There's also been the field of predictive AI, where big data decision supports can be done. And there has been, for examples of cancer recognition, which has improved miss rates of cancer, which halved it. And the Yale Hospital, for example, has an early adopter called the Rothman Index. It's a tool that reflects patient acuity and provides alerts. And in our school as well, we're currently looking at some data analytics to determine avoidable admissions in emergency departments. So those are kind of the broader area. And I'm not going to touch much on the AI in research because people have already indicated a lot of these tools, Elicit, Cite AI, Semantic Scholar, Atlas TI. However, the coding does upload to OpenAI, and you've got to consider data security. Otter AI is a meeting notes thing, which my students have been asking me, can I use it when I do interviews? And I heard that Covidence AI is coming. I'm not sure. Maybe somebody can tell me. So how will this change our nursing education and our nursing practice? And I think for me, in the first instance, we have to have a growth mindset. And we have to prepare our workforce what is out there. We have to prepare to learn new ways to gather and use information ethically. And I think a lot of the issues around ChatGPT is around ethical learning. Tool experience must be local and must be integrated in our nursing and education practices. And whatever we use must be easy to use, and output interpretation must be intuitive, and it must benefit the outcomes of the patient or the student in learning. Now, the challenges people have touched on, there's biases in current data sets. We have got major issues around digital health literacy, there are ethical issues, and we really have to think about how we're integrating this technology in our practice. And then just to end off, and this is my personal belief, I am the digital health chair of the faculty, so I'm a big adopter. I believe we must be early adopters. We must ride this wave to become thought leaders in artificial intelligence in nursing. And we must work really hard at working out how we will manage the space between technology and our clients, whether they are students or whether they are patients. Thank you.